Hello, my name is Juan Gabriel Jimenez Garcia. I'm one of the residents at Florida International University, at Jackson Memorial Hospital, and at the Miami VA. And I'll be talking about this clinical vignette we titled Confronting the Unseen, Primary Intra-Orbital Squamous Cell Carcinoma. So squamous cell carcinoma of the orbit is a rather rare malignancy with fewer than 15 cases reported. Typically, when we think of a squamous cell carcinoma in the orbit, is secondary to some pure neural invasion from some skin lesion or metastasis. However, when we have a primary lesion with no known metastatic site, it is more of a rare and more of a challenge to diagnose. And there's quite a few thought processes as to how this came about, such as some sort of ophthalmological intervention seeding cells into the orbit. But what is true is that this is a challenging case that presents even more challenge when managing it. So for this, we have the case of a 74-year-old male patient with a history of asbestos exposure as well as COPD that presented to the hospital with several weeks of right eye swelling, pain, headaches, and diplopia that were worsening. It is noteworthy to point out that he had a history of cataract surgery about 8 months prior, and following this surgery, he started reporting having some right eye discomfort and having some issues with visual changes and headaches and numbness that progressed and worsened and worsened and worsened until his presentation. When we saw him, it was noteworthy to point out that he had palpable, firm, tender mass in the superlateral right orbit with some moderate chemosis, as well as some keratotic papules and hyperkeratotic crustic papules on the right shin and on the left dorsal hand. He was admitted for concerns of orbital cellulitis and was started on antibiotics. In the initial CT of the head that was ordered, the infiltrated mass was of concerns of orbital cellulitis. Nonetheless, his white blood cells were not elevated, and we proceeded to obtain an MRI with contrast that revealed a 3.5 centimeter lesion that was in the right orbit and involved the sphenoid bone in the adjacent soft tissues. At this point, we brought in neurosurgery as well as ophthalmology for guidance on the management, and we discontinued his antibiotics and started him on steroids, which helped with his headache. With guidance, we proceeded to obtain orbitotomy as well as biopsy of the lesion, which confirmed it to be a moderately differentiated squamous cell carcinoma. Afterwards, the patient was discharged with management outpatient from a multidisciplinary team consisting of oncology, radiation oncology, and ophthalmology. So this case kind of highlights what is an intra-orbital squamous cell carcinoma and the challenges presented from it. They're quite, from the 15 cases in our literature review, there's some versions of it, some showing us such as desmoplastic and spindle cell variants, from which especially the latter, might be more secondary to pluripotent stem cells. There's at least 3 cases that showed any ophthalmological surgical intervention preceded this orbital squamous cell carcinoma, thinking that the cells were seeded into area through the surgical intervention. However, there's still not very well known cases of how this happens, but what is definitely unknown is the management of this. Since there are very few cases, there is still not a very well defined pathway path for management following the diagnosis. There have been surgical excision with adjuvant chemotherapy and radiation done, and vice versa. However, there's still no gold standard for which path to do. As in the case of this patient, he was offered to be followed outpatient while a tumor board was held with the radiation oncologist and ophthalmologist to determine what would be the best path to proceed for him. So this case illustrates the challenges of managing and diagnosing such a rare, unique malignancy, and to raise awareness of this.